Welcome, friends. We're going to wait just a couple of minutes before we get started, just to make sure folks have a chance to log on to the Zoom. Greetings, friends. We are so sad that we are not all together at the Legislative Office building with you today. At the same time, we're excited that doing this event virtually allows us to connect with so many of you who in the past haven't been able to travel to the Legislative Office building. For nearly 150 years, the Schuyler Center for Analysis and Advocacy has advanced policies that improve child health and well-being, enable families to achieve economic security, and augment opportunity so that all New Yorkers have a fair opportunity to thrive. There are more than 6,000 registered lobbyists in New York State. Most of them are not focused on generating systems change and long-term wins for children and families. We are. I'm Kate Breslin, and I'm honored to lead this organization. Schuyler Center is also the home of Medicaid Matters New York, the statewide coalition focused on bringing Medicaid beneficiary concerns to policy conversations. You'll hear today from our Whip Smart policy team and the coordinator of Medicaid Matters New York. Thanks so much to all 379 of you who registered to join us today for our annual State of New York's Children Data Briefing. A special shout out and thanks to legislators, commissioners, and agency leaders joining this morning. And an extra special shout out to our Commissioner of the Office of Children and Family Services, Commissioner Sheila Poole, who has joined us every year since we began this event. Thank you, Commissioner. Today, we are releasing our State of New York's Children Data Book. We affectionately refer to it as SONIC, and it's available on our website at www.scaany.org. There you'll find much of the data that you'll see here today and a whole lot more, and extensive documentation of the sources of that data. We conceived the State of New York's Children Briefing as an event designed to complement the governor's State of the State and focus specifically on the status of New York's children and families. We will share salient data on a range of indicators related to the well-being of New York children and families, and highlight policies proven to set children on a path to thrive. While data can never fully capture how children are faring, it is exponentially so this year, both because data about COVID-19's impacts are still emerging, and because many of the challenges our children have faced over these long months are intangible. They're hard to measure, and they may be lasting. We remain hopeful that later this morning, when the governor delivers the fourth and final installment of his State of the State message, that he will share his aspirations and plans for New York's 4 million children, the hundreds of thousands of them living below 100% of the federal poverty level, and the racial and economic inequality that blunts their opportunity to thrive. We are hopeful to hear the governor speak about that. It's time to address child poverty thoughtfully, intentionally, and with an array of evidence-informed policies that will reduce poverty and improve long-term outcomes. Among the policy recommendations you will see throughout this presentation is our recommendation that our leaders commit to ending child poverty, starting by cutting child poverty in half by 2030. Our aim is to make sure that our policies understand that the state of New York's children as we enter 2021 is sobering. More than 36,000 New Yorkers have perished, many leaving children or grandchildren behind. Nearly 3.9 million more New Yorkers filed for unemployment this year than last. 1.5 million New Yorkers reported in late November their households, sometimes or often, did not have enough food to go around. Hundreds of thousands of New York households are behind on rent or mortgage payments. Since COVID-19 put the state on pause, access to the internet and devices has become an essential lifeline for New Yorkers to participate in online school, attend appointments with doctors or social workers, and to work remotely. Yet 23% of New York households do not have home internet, and hundreds of thousands of students have no device or use a shared device. With all the challenges our children have faced this year, it is critical that we take a close, intentional look at how children and families are faring and how, as New York turns the corner from crisis to recovery, we can rebuild our systems to better serve children and build a stronger New York. We have the tools. We need leaders with the will to use them. You will hear now from Dee Dee Hill, our Director of Policy, Crystal Charles, Policy Analyst, Bridget Walsh, Senior Policy Analyst, and Laura Castle, Coordinator of Medicaid Matters New York. Each will address different policy areas while also articulating the through lines, how and why these policies are all connected and all part of a whole child, whole family approach. So I'll turn it over now to Dee Dee.
Good morning. So as Kate said, I'm Dee Dee Hill. I'm Policy Director for the Schuyler Center. And like Kate, I'm feeling bittersweet this morning. I miss seeing so many of you in person in the LOB. But I'm so glad that we can at least gather this way to talk about how we can work together this year to improve the well-being of all New York children. I'm going to start where I always start, which is with a reminder to all of us about what all kids need to thrive. They need strong and economically stable families. They need healthy bodies and minds, safe homes and communities, and a sound education, including an early education. All New York children need all of these things to thrive, especially after enduring this incredibly difficult year. So moving to the next slide. Among the key indicators of child well-being is the extent to which our children experience economic security and have access to high quality early learning. We know that children, particularly our youngest children whose brains are growing at a breathtaking pace, are uniquely vulnerable to the impacts of adversity and deprivation. At the same time, positive, loving interactions with parents, with caregivers, with childcare providers, these interactions can buffer the impacts of poverty and other stressors. Unfortunately, on the indicator of child economic security and family economic security, New York does not do well. New York entered the pandemic with an unacceptably high child poverty rate of 18%. And due to historic, systemic, and ongoing racism, that percentage is was a full 10 points higher for Black children and 7 for Latino children. Compared to the rest of the nation, New York children were more likely to live in poverty than children in 32 other states. And I want to be clear, these rates do not include the hundreds of thousands of children and families pushed into poverty and near poverty since the pandemic hit New York. That means that child poverty in New York is much higher now. On a more positive note, New York was at least making progress in reducing child poverty before the pandemic struck. Moving from a post-Great Recession high of 23% during the period 2011 to 2014, down again to 18% before the pandemic hit New York. Also positive is that child poverty had been slowly declining in every racial and ethnic group, although with the sharp disparities persisting. I think the important lesson and sobering lesson to draw from the state's experience after the Great Recession is that if we as a state, if we do not take immediate decisive action, it could take years, it could take another decade to reverse the child poverty impacts of the pandemic. I think we have to all commit to not let that happen. Shifting to childcare, access to quality childcare is essential for family economic security. It's essential for children's academic and social emotional development. It's essential for a healthy economy. Yet the cost of childcare in New York, which exceeds $24,000 in most parts of the state if you have 2 children in care, is out of reach for nearly all New Yorkers. In fact, according to federal guidance, to be affordable, childcare costs should not exceed 7% of family income. And as you can see from this slide, for the vast majority of New York families, childcare costs far exceed that affordability level. I want to be clear that the high cost of childcare is fully justified. High quality childcare takes resources. Our little ones, they need low educator-child ratios to get the one-on-one attention and care that they need. Our little ones need educators who are fairly paid, well-supported, and well-educated. They need safe and stimulating environments. And it's also important to note that the pandemic has made quality care even more expensive to provide, and again, appropriately so. Our providers have had to allow for social distancing. They've had to cut enrollment, or they've needed to engage in constant cleaning, repurpose rooms. So the bottom line is New York is overdue to recognize and fund childcare as a public good that is accessible to all. So I'm not going to sugarcoat it. The economic and early childhood education challenges facing New York families and the state, they're daunting. But there are concrete steps New York can and should take to reduce child and family poverty and improve children's academic readiness and overall well-being. First, New York needs to address child poverty with the urgency it deserves, starting this year. And Kate's going to talk more about that. But there are approaches that we know work and that can yield immediate results, including strengthening New York's refundable tax credits, starting with expanding the state's child tax credit to cover our youngest children under the age of 4 who are still excluded from the state's child tax credit. Second, we can invest in childcare immediately and in a way that paves the way to transformation. New York has a unique opportunity to invest federal stimulus funds that were just released to provide both short-term emergency relief to the sector and to the families who are reeling from the pandemic, and to kickstart implementation of the soon-to-be released childcare availability task force recommendations. And these recommendations, I can't say too much, but we are expecting them to lay out a bold plan to dramatically expand access to childcare. And then finally, in the area of pre-K, New York is overdue to live up to its promise of providing universal full-day pre-K to all New York's 4-year-olds. We've hit that mark in New York City. It's time to deliver and provide access to families in the rest of the state. So with that, I am going to hand the podium over to my colleague, Crystal Charles.
Good morning, everyone. I'm Crystal Charles, Policy Analyst at Schuyler Center. The pandemic has underscored what we already know. All children and youth need strong birth, kin, and foster families. Starting in 2020, we have all been isolated via lockdowns, which on one end of the spectrum necessitate remote work and learning, and on the other end have caused lost work in hours or positions, increased exposure to COVID-19, and placed many households at risk of eviction. For youth in and recently aged out of foster care, placement in family-based care became less likely, reunification with their birth family was delayed, college was disrupted, and prospects for independent living evaporated in front of their eyes. Over time, New York has steadily reduced the number of children in foster care. This is thanks in part to substantial investment in preventive services, which provide crucial supports to families in crisis. Preventive services include home visiting, housing assistance, and childcare. Preventive and kinship care support services have assisted families navigating the unexpected hardships of this pandemic, from digitally meeting with families to connecting them to resources and providing devices and food. Black and brown children continue to be disproportionately represented in child welfare. Black children are nearly twice as likely as white children to be in reports to the state central register, more than twice as likely to be in indicated reports, and 5 times more likely to be in foster care relative to comparable rates for white children. As you can see, Hispanic and Native American children are also more likely than their white peers to be in SCR reports and in foster care. These disparities follow children through each stage of the child welfare system, from entry to exit. New York State has recognized the significant racial bias and disparity in the system and is taking steps to address it. In order to achieve progress, racial equity must be a priority for New York State. Children experience better outcomes when cared for by supportive families. When children are placed with kin, they experience less trauma and are more likely to stay in their communities of origin and with siblings, resulting in better mental and behavioral health, safety, and well-being outcomes. New York State places a higher percentage of children in congregate care and a lower percentage of children in approved relative homes than the national average. However, we have seen an increase in kin gap placements in 2019. This is good news. The Kinship Guardianship Assistance Program, kin gap for short, is an adoption alternative for relatives or close family friends to provide a permanent home for children unable to return safely to their families of origin. It is a strategy that can help New York reduce the amount of time children wait in foster care, which exceeds the national average. To improve child welfare in New York State, we must strengthen families by reducing child poverty, fund our preventive services so that they can continue to assist families in crisis, support a timely connection to and support of family-based and kin care, and finally, support transition age youth as they prepare to live independently. Thank you. I will pass it along to Bridget Walsh.
Thank you, Crystal. My name is Bridget Walsh and I'm Senior Policy Analyst. And it's a pleasure to be able to present on the health and public health aspects of the data book. Although like the rest of my colleagues, I wish we were in person. Hopefully we can do that again next year. I want to start with this definition of health, just to provide some context to how we approach this section. The World Health Organization defines health as a complete state of physical, mental, or social emotional well-being, and not just the absence of disease or infirmity. Through that lens, policies and programs that go beyond simply providing medical care, those include alleviating food insecurity, providing stable housing, providing cash assistance to families and childcare, all relate to and support child health. This definition also encompasses factors that predict a child's future health, such as maternal health and well-being. Even before the pandemic, many of New York's children, particularly those living in poverty, struggled with accessing healthcare and supportive services. Now there are new barriers. Many families with children are experiencing the loss of income, food insufficiency, or problems paying rent. The closure of schools and community sites make it difficult for students to receive school meals, school-based healthcare, counseling, and early intervention to obtain those services. In addition, parental stress due to problems with childcare and remote learning, the loss of income and food insecurity, or other pandemic-related pressures all have a negative impact on children's emotional and mental health. These conditions may increase exposure to toxic stress and adverse childhood experiences, or ACEs, which can have a lifelong effect on physical and mental health. Reports based on insurance claims show declines in rates of vaccinations, child development screenings, dental services, and outpatient mental health services due to the pandemic. All of these factors exacerbate pre-existing inequities in our healthcare system. So let me start with some good news. Almost 98% of all children in New York are now covered by some form of health insurance. According to data from the Georgetown Center for Children and Families, only 4 states have a lower rate. New York improved coverage rates over the past few years, even as other states saw an erosion in coverage for low-income children, young children, and Latino children. That is an accomplishment that New York deserves to be proud of. I also want to point out that while more parents have insurance than ever before, we need to watch for signs that the pandemic is eroding their coverage. Research shows that parental insurance helps children in multiple ways, including by helping parents be physically and emotionally healthy so they can care for their children. Coverage also supports family economic security by protecting families from unexpected or high medical expenses. We know that having insurance isn't the same as having access to health care, but in most cases, it is a prerequisite. Having the majority of children and families covered by health insurance allows policymakers and advocates to focus more on how systems, organizational, financing, administrative, and workforce can adapt to expand and support the services that children and parents receive. Although the number of children covered is good news, we must also dig into the specifics of those who remain without insurance and why, because disparities persist. We need targeted efforts to enroll those remaining children, as well as a new policy that will keep young children continuously enrolled in coverage. We must also ensure that more parents and caregivers have access to affordable health insurance options, as well as robust and continuous postpartum coverage for the health of moms and their babies. So what are some of the solutions? We are advocating that New York ensure continuous health insurance coverage for every child until they reach the age of 3. With this policy, all children will have access to routine primary and preventive care, including many of the screening programs you see listed in the data book, to identify early problems and provide necessary treatment. This change will relieve stressed families from the process of having to think about enrolling their children during a hectic and stressful time. Reducing child poverty is also integral to improving health. Children who experience poverty, particularly during early life or for an extended period, are at risk of a host of adverse health and developmental outcomes that can continue throughout their lives. We need to ensure that providers and programs have what they need for children and families to catch up on missed primary and preventive care. This includes efforts to improve early screening for developmental delays in children, as well as screening mothers for depression. Finally, we need to think about public health as integral to addressing the needs of children and families. This means ensuring New York's public health infrastructure has the capacity to prevent disease, promote health, and prepare for and respond to both emerging threats and the social determinants of health. And with that, I will turn it over to my colleague at Medicaid Matters New York, Lara Castle.
Thank you, and good morning, everyone. I'm so pleased to be here today as part of the policy team of the Schuyler Center for Analysis and Advocacy. Medicaid Matters, as Kate said in the beginning, is the statewide coalition representing consumer interests in Medicaid. And for those who may not be familiar, Medicaid is the public health insurance coverage program that is funded by the federal government and the state to provide coverage for low-income people and people with disabilities. Being housed at the Schuyler Center is a really good fit in a number of ways, particularly because our policy goals are very much aligned, and because Medicaid and insurance coverage generally play such an important role in the overall well-being of children and families. As part of the focus of today's event is data, I'm going to walk through a few Medicaid statistics that demonstrate the importance of the Medicaid program. As you see on the slide, children made up, as of August of last year, 39% of the Medicaid program and the Child Health Plus program in New York. 42% of children are on Medicaid or CHIP. And as Bridget pointed out, New York does a really good job of keeping kids covered. When it comes to public coverage, New York does right by kids. In an October study that Bridget also mentioned, New York was the only state to have shown a drop in the uninsurance rate for children between 2016 and 2019. The same report also showed that the uninsured rate for Latino children is 4 times lower in New York than the rate nationally. If anyone doubted the importance of Medicaid before, the 2020 enrollment data might help change their minds. As you see from the chart, the 2020 enrollment data shows that over 700,000 new enrollees turned to Medicaid for their health coverage due to the economic downturn related to the pandemic. The 2019 numbers demonstrate in the dark blue line that enrollment typically in a typical year remains relatively flat. And in a year like 2020, the enrollment skyrocketed. And again, this demonstrates the importance of having a program that people can turn to in times of trouble to keep them well. A report out just last month once again speaks to the importance of Medicaid to children and families. Keeping Medicaid strong promotes long-term benefits. The study showed that providing comprehensive Medicaid coverage for pregnant women and children results not only in the medical and overall health benefits that we might expect, but also educational achievement across the course of a child's educational career, greater economic security for families, as well as return on investment at the government level. So what do we need to do? As far as Medicaid consumer advocates are concerned, there are over 6.5 million reasons to keep New York's Medicaid program strong. That's the number of people Medicaid serves in our state. As it relates to children and families, Medicaid is an important factor and can be a vehicle towards reaching greater policy goals, including reducing child poverty, maintaining and reaching overall well-being, not just medical and health outcomes for children and families, but overall well-being over the course of their lives. And protecting Medicaid needs to be seen as a key factor in helping the state reach greater health equity. And last, but certainly not least, we must remember the intent of the program, which is to provide comprehensive coverage for the people it was intended to serve, low-income people and people with disabilities. I will kick it back over to Kate now.
Hey there. Thank you. Awesome team. I want to respond verbally to some questions that we've gotten in the chat about access to the materials. The data book is available on our website, and which is, as I said earlier, it's at the bottom of your screen, but I know some people aren't viewing. It's scaany.org. The data book is available there, and please feel free to share the link to that widely. No permission needed to share that. And we are taping this webinar, and it will be available for listening and viewing on our website. And for some, we are going to engage in a question and answer. We've received some questions in advance, which we'll try and address. And as you have questions, for some of the more weedy questions, please feel free to use the email address at the bottom of your screen, which is info@scaany.org. And we'll make sure that those questions get to the right policy expert. Of course, if you already know the individual's email, please use it, but we'll also, using the info question, we'll also be able to move those out. So, so one of the things we've talked a lot about today is child poverty. And as I talked about earlier, that is certainly one of the through lines that we see through a lot of the issues that we care about. And there's not one single solution. So we're really excited about a new bill that's been introduced, the Child Poverty Reduction Act. It's been introduced in the New York State Legislature in both the Senate and the Assembly. Senator Ramos and Assemblymember Bronson, together with many co-sponsors, which we're thrilled about, that aims to cut child poverty in half. It would make a commitment to take action on child poverty over the next 10 years, create an advisory body to generate those proposals, and require that the Division of Budget assess policy and budget decisions with regard to their impacts on child poverty and inequity. I think I'll say that, one of the reasons we're particularly excited about this is because despite the fact that our policymakers talk about poverty, they care about it, and do things that they hope will address it. Many of the efforts that we've observed over the last decade or more have been scattershot. We haven't taken a comprehensive look at the multitude of policies and budget decisions that can have an impact on child poverty, positive and negative, and not in just one arena. And we also haven't actually measured the impacts of these policies. We have the tools to do this. There are evidence-based interventions that can work. And as I said, they don't just sit in one bucket or one policy area or one agency. We understand that there are evidence-based solutions out there, and it's time to use them. So you'll be hearing more from us about that as we go forward. I'm seeing the bills are getting new bill numbers, actually, because it's a new session right now. And so anyway, so you'll hear more from us about those. And also, I would urge any of you who are not already on our listserv to please use the info or to go on our website to sign up for our listserv. So I'm going to turn to some questions for our fantastic team that we've gotten from some of you all, some of them in advance and some of them just now. So let's see. For Dee Dee, you mentioned something about the forthcoming release of the Child Care Availability Task Force recommendations. What are you expecting, and what can you tell us about next steps?
Thank you, Kate. As many of you who are watching know, I love to talk about childcare. It's dear to my heart. And I really love talking about the Child Care Availability Task Force, on which I was very honored to serve. it has been hard at work for about 2 years, and our work is just about done. And the task force is poised to release recommendations this month. And like I said earlier, I can't say too much, but I can say that they're on track to be ambitious and comprehensive, and to lay out a plan for New York to dramatically expand access to childcare, and to significantly increase investment in the sector, to increase compensation for the childcare workforce, which is almost entirely made up of women and predominantly women of color. The task force plan, I think, is going to really provide New York with a roadmap. It was informed by state and local government leaders, by advocates, by providers, by parents. It's data informed. So I'm not going to say any more, but it's a powerful plan. And at the same time, as I mentioned earlier, and as many of you know, the state is also set to be receiving about $450 million in emergency childcare funds from the latest federal COVID relief package. It's not enough. It's not all that the sector needs, and not all that families need, but it really is a stars are aligned moment. These funds can and should be used in a way that not only meets the immediate emergency needs of the sector and of families, which are many, but it can also be used in a way to kickstart implementation of the task force plan. Again, prioritizing expanding access to low-income families, to families of color, immigrant families, those communities that were hit hardest by the impacts of the pandemic. So, as for next steps, simple. We need it to be released, and then the state needs to implement. State needs to use federal and state funds to kickstart, and then figure out a way to sustain the investment. And this is entirely possible for New York if there's leadership and commitment.
Thanks, Dee Dee. And thanks to folks who we're getting some questions, so thank you for that. Crystal, can you talk a little more about aging out of foster care, kind of what that means, and what some of the kind of most important key points are?
Definitely. Aging out means that when a youth who is in foster care reaches the ages of 18 to 21, they are expected to have a plan to leave foster care and live independently. Ideally, they do have that plan and they can live independently after leaving foster care. But once they hit 21, they have to leave. And this is the current context, at least before the recent federal stimulus package came out. So that increases it by 1 year. So youth can now stay in care until 22 through September of this year. And youth who have already aged out before the current crisis can return to care until the age of 22. So thankfully, this kind of speaks to the issue of aging out. And we have also done some work in the past year to raise this issue in the public eye. And there was a bill that was signed into law by the governor at the end of the year that allows youth to re-enter in New York State. Of course, that was before the recent stimulus package. And OCFS also introduced protocols in July of last year that would allow youth to re-enter care, and they have been working with counties to help them reach out to youth who have already aged out during the pandemic since March of last year. So we will, moving forward, be tracking the implementation of both the stimulus package and the state policies on this issue. Thanks.
Thanks, Crystal. Yeah, I think so many of us, had young adult children who came back to the nest during the last year, and, realized that, without those kinds of supports, young people, young adults, or people transitioning to adulthood are really in the lurch. So thanks so much. Bridget, you talked about sort of the importance of covering parents and the health of parents. Can you talk a bit about mental health and parental mental health?
Yes, that's a great question, because the Schuyler Center is actually working on that issue right now. Maternal mental health is a big public health problem. And we've been struggling, and others struggle with solutions to this, because it sits at what we like to think of as the uneasy intersection of child health, behavioral health, adult health, child welfare. There's a number of systems that are involved. And that has made policy solutions sort of more complicated. But maternal mental health, which includes maternal depression and also a broader category of perinatal mood and anxiety disorders, really does take a toll on both moms and their families. It interferes with a mother's ability to care for herself and to help a child develop. We know that a lot of this is highly treatable. A lot of these conditions are highly treatable, but that many women don't get screened or receive treatment. We're also learning, as we spend more time in this area, of the great impact of inequities in this area, with fewer women of color receiving services, either screening or treatment. We have been coordinating a set of partners under the Moving on Maternal Depression project here in New York. It was part of a larger state national learning collaborative that we helped coordinate here in New York. And we're continuing to work on that, even as the national collaborative has closed. What we're looking at with state agencies, advocacy partners, and providers, and most importantly, with the voice of women with lived experience, is how the systems we can help develop better policies for systems that cut across sectors, with health equity as a focus. This is an important issue for much of the work that we're doing, including the poverty work, the child welfare work, and family economic security. So it really does cut across a lot of the work that we're doing. I'd urge anybody that has an interest in this issue to look on our website. We have a lot of resources and materials and connections to the Moving on Maternal Depression task work that we're doing. And I'd be happy that if anybody's interested, to help them get involved in the work that we're doing.
All right, welcome. Welcome, yeah, to that work. Okay, Lara, definitely some questions on Medicaid. So I guess I would say, why is Medicaid such a large portion of our state budget? And we've seen a lot of growth. Are we concerned that that might make it a particular target for what might get cut?
Thanks, Kate. That is certainly not a new question. Medicaid comprises nearly a third of the overall state budget. So Medicaid has always been at the forefront of the annual budget discussion because it does spend so much money. And it spends as much as it does for all the right reasons. Because in New York, we've made the commitment, New York State has made the commitment to provide a comprehensive program. Not all states do that. New York covers dozens of services that other states consider unnecessary, like dental care, oral health, like glasses, like prescription drugs, like long-term care. Those are all things that New York has chosen to cover because they are essential services to keep people well. And that's why New York spends what it does on its Medicaid program. Yes, it will continue to be a question in this year's budget, no doubt. Luckily, the state is currently benefiting from an enhanced federal match. As I stated during my presentation, the program is funded both by the federal government and by the state. And the federal portion is enhanced right now due to the economic downturn. And that enhancement will continue at least through the end of June as of right now. And so we should be able to continue to cover the people who newly enrolled in the program. And, you know, we will continue to fight the good fight to bring the message to the legislature and the agencies and the governor's office that cutting Medicaid is short-sighted, and we need to make sure that for many of the reasons that we stated this morning, Medicaid needs to remain an essential part of helping New York reach its goals, its overall goals.
Thanks, Laura. We've had a couple of questions around the working families tax credits. So specifically, Dee Dee, if you would talk, a brief overview of the earned income tax credit and work on that, and the child tax credit as well that you mentioned.
Yes, I'd be happy to. I like refundable tax credits almost as much as I like childcare. So, and the reason is that refundable tax credits like the EITC, like the child tax credit, they have been shown to be among the most effective strategies for pulling families, pulling children out of poverty and into economic security. So a few things that sort of the basics of refundable tax credits are, if they're fully refundable as they are in New York State, they're available to low income tax filers, even if they don't owe taxes. So that's really important. They also encourage families to work, to take promotions because the amount of credit increases to a certain point and then gradually decreases. So we don't have the cliffs that we have in many other programs. So these have been shown to be tremendously effective. And like I said, New York State has a state EITC, has a state child tax credit. We have relatively robust tax credits in the state as compared to other states. However, we have been focusing a lot at Schuyler Center and with many partners who are on the phone that we're focusing on some of members of the New York community that need these tax credits most, but are excluded. So among those who are excluded, and I mentioned this in my remarks, our child tax credit omits children under age 4. And I think this will come as no surprise to all of you that this, we find this unacceptable. It doesn't make any sense. The credit is designed to support families who are raising children and to cover the high cost of raising children. And all of us who have had kids know that the little ones are expensive. And so that's something that New York needs to fix and almost did last year before the pandemic hit. So we appreciated that. That there was a proposal in the executive budget to begin to address that omission, but it like so many things, fell out of the budget after the pandemic hit. We need to get back and fix that. And then in the area of the EITC, among those communities who are omitted are many immigrants, hardworking immigrants, who, so we need to fix that. And also young adults who don't have children. So it's the age group 18 to 25. And this is a group that actually experiences poverty at much higher rates than the rest of the population. They are also exactly at that moment in their life when they're trying to, gain a foothold in the workforce. They often have lower income jobs because they're just starting out. They actually are often, without having access to the EITC, they're taxed into poverty. So that is something that is critically important that the state address, and particularly right now, because we know the emerging data about the pandemic is really has unemployment amongst this group of young adults is skyrocketing. Thanks.
Thank you, Dee Dee. So as we begin to close, I want to just say that this event for our small but powerful team is an all hands on deck event. So a big thanks to every single person who you all see on your screen and have heard from, and those who you haven't. Our powerful team of 10 is all hands on deck today. So, and just a reminder for everyone, please feel free to, use the email address, contact us. There are some pretty detailed questions that we're happy to kind of get into the weeds on one-on-one, and go to our website. Just a reminder that the decisions that government makes have an impact on people, on families, on neighborhoods, on how we live, how we grow and age. And those policies can have a particular impact on people who are living at the margins. Decisions that our legislators and our governor and people in the agencies are making every day affect our taxes, our schools, our parks, whether there are parks, whether there are roads. And public policy directly impacts the opportunities that we and our children have, and it affects the distribution of resources to communities. It can make the ground fertile for opportunity, and it can contribute to its desolation. And we're in this every day to try and make sure that the ground is fertile. And we appreciate that you're in it with us. And we look forward to the coming months and years of working together to really make sure that the ground is fertile for all of our children and families in New York. So with that, we will close, and thank you.